When this third test came out negative, I jumped. And when I looked at him, I was like, my son, you are free from the virus now, you're okay. I was very happy, and up to now, when I look at him, I'm always very happy.
The strength and commitment of women like Patricia, who gives peer support in Malawi, is built on their own stories as HIV-positive mothers. Her first babies, born 7 years ago, were twins.
Being a boy and a girl, I was like, wow, thank you. This is where I'm going to stop. It was like, I have a boy, I have a girl. That's all, yeah. But then I didn't know my HIV status.
The twins died when they were 4 months old, one on Saturday, the other on Sunday. Soon after, Patricia herself became sick and tested HIV positive.
It was a very, very painful moment, because if I had that courage to go to the hospital and know my HIV status first before I got pregnant, the chances for me to transmit the virus to the babies could have not been there. So I was like, I was selfish.
Patricia worked through her pain and went on to have a baby boy. Today, a healthy 5-year-old who is HIV-free. Then, 3 years ago, she saw a notice in her health center looking to recruit HIV-positive mothers who had undergone PMTCT to work as peer supporters.
They want these women to help their fellow women, to educate them, to counsel them, to move with them, to encourage them. So I was like, I can do this. I don't want to have my fellow women go through the pain that I did. I just want to help them.
The power of experience like Patricia's has long been recognized. But how do you best harness it or measure its impact? The program Patricia joined was a cluster randomized trial called PURE, set up to answer those questions. Malawi had already rolled out option B+, where pregnant women who test HIV positive are immediately put onto lifelong treatment. But it was quickly realized that some women were dropping out, and that retaining them in long-term care will be the biggest challenge.
If a woman is not coming back, then you don't know whether they are swallowing the pills. And if they are not taking the pills, then they are not going to have viral suppression. So they are basically more likely to transmit the virus to the infants.
In the PURE study, 21 rural health centers were randomized into 3 groups. 7 sites recruited mentor mothers, 7 recruited expert mothers, and the last 7 sites had the standard peer support of the national program. Successful candidates needed to be HIV-positive mothers who had been through PMTCT and were willing to be open about their HIV status. Because these were paid posts, there were many applicants. To maintain confidentiality, it was impossible to get references.
We really had to be very careful. Some women were actually faking being HIV positive. So we had even to go through the master cards at the health facility to see who really is on antiretroviral therapy. So it was a lot of work, synchronizing, probing more to get the real people.
The selected mothers were given 3 weeks of training with refresher courses every 6 months. When a woman tested positive, Patricia will be on hand to accompany and counsel them intensively until she was sure they had understood the diagnosis. She will follow up with home visits to remind about appointments and help overcome obstacles. For women like Chikondi, this made a huge difference. Chikondi had known her status for years, but had repeatedly refused treatment.
I was very young when I first tested HIV positive at antenatal. I did not understand the danger it meant. My husband refused to be tested. I was afraid he would divorce me if I told him I'm HIV positive, so I ran away from treatment. I had 5 children without treatment. My eldest daughter is HIV positive. Another of my children died.
We do share experiences. I've gone through this, and I overcome it in this way. So during our interactions, that's where they got that trust that I'm saying the truth.
After Patricia helped her start ART, Chikondi had 3 more children, all negative.
I was pregnant again when I met Patricia. She persuaded me to go on to treatment. If I had not met Patricia, then my other children could also be infected.
The PURE study results showed that the work of expert and mentor mothers like Patricia leads to a significant improvement in both the uptake and retention of women on PMTCT.
The way we designed the study, it was quite rigorous, whereby we defined what the mentor mothers at the facilities should be doing, the expert mothers in the communities, what they will be doing, and the supervision was quite significant. So I am confident that we can reproduce the results from the study.
The PURE results were backed up by a similar study in Nigeria. The MoMent study compared the use of paid, well-trained, supervised and supported mentor mothers with a standard mentor mother program.
The reason why we went into engaging mentor mothers as our study intervention was really because of our confidence that mentor mothers could do this job, but also of our realization that it needed a bit more structure in order for us to get maximal or optimal outcomes from peer counseling.
The results were very clear. Closely supervising and supporting mentor mothers made a big difference to their effectiveness.
When the mentor mothers go out into the field and come back to the healthcare facility, they have someone they can go back to and say, this is what I encountered, or these are the difficulties I'm having. How can you help me fix these problems? How can you help me understand better?
The supervisor of these mentor mothers really helped. She makes sure that all these activities that is supposed to be done is well done to, at the age, have a negative child.
Women supported by well-supervised mentor mothers were also much more likely to bring their babies to be tested for HIV.
What we need to do is actually provide the structure and supportive supervision to motivate mentor mothers to do their work.
This one is negative client.
This is good evidence from large trials. But researchers say the mentor-expert mother intervention is multifaceted. The mothers counseled, provided peer support, organized support groups, did defaulted tracing, home visits and family counseling, and the close supervision led to some health center improvement.
Although we have shown with our results that peer support is beneficial in retaining mothers, we don't really know which aspects of the different interventions were most effective. Whether it was the one-to-one contact that mothers had, or it was the home visits or the support groups. So this is the next step. We now need to find out which is the most efficient way.
Likewise, researchers and mentor mothers pointed to many different reasons why women dropped out of treatment.
A woman goes to her first antenatal visit to have the health of her baby checked, not to have an HIV test. So her reaction is often, "No, I cannot take the ARVs. I'm not ready. I must speak to my husband first."
In terms of dropping out, young women, teenage mothers, were particularly at risk. Women that came to book very late in the third trimester, and then women that are finding out their HIV status for the first time during that first antenatal visit.
I cried when I tested positive at antenatal. I went out of the clinic and I started shouting at my husband. I could not believe it. It took several months before I could accept the results. I told the nurses that I could not disclose to my husband, so they helped me. They talked to my husband pretending that I had not been tested yet and asked permission from my husband to test me. They told him to get tested at the same time. We were both positive. Disclosure is the most important thing for someone to freely take their medicines.
The main reasons my clients drop out of treatment, it was fearing of getting divorced.
We had some mothers who were told not to take their ARVs by the prophet of their church.
One was like, I have to be taking medication each and every day of my life. So it was like a burden to her.
I think women face issues in PMTCT when it comes to receiving services from the health personnel. If you work in the health setting, you discover that some health personnel, some health providers, they act to these women the way the women feel very bad.
Fear of divorce was the most common reason.
Mostly, the women lacked partner support. So for the sake of preserving their marriages, these women stopped accessing treatment. For some of them, their drugs were thrown away in the toilet. For the others, their spouses said, you don't need to go to the facility to get the medication or else you'll be divorced.
Expert mothers say shifting wider attitudes towards HIV within the community will help a lot. Reworking traditional prevention messages like the one touted by this street singer in Malawi.
HIV is the killer.
Everyone knows HIV kills, but the huge benefits of HIV treatment, both in terms of individual health and reducing infectivity, are much less well understood. Patricia found people often did not believe she is HIV positive because she doesn't look sick. And hardly anyone knew that successful treatment massively reduces infectivity, even though this is the central tenet of PMTCT and test and treat. She found once husbands understood the benefit of ART, they were much more willing to accompany their wives for testing. Patricia helped many of her clients disclose to their partners, and even took several husbands to be tested.
When my wife got tested, I was very disappointed. Our marriage nearly broke up, but I took advice from Patricia. The trouble in Malawi is that men think they are superior. If a wife tests HIV positive, then it is the wife's fault. To change this, we need men to talk to men.
In Patricia's district, they managed to get 90% of husbands tested because village chiefs made it mandatory for men to go to antenatal sessions. But this was the exception. More typically, in this health center in southern Malawi, expert mothers only got the husbands of 11 of the 44 women they enrolled to be tested. So to bring in reinforcements, organizations implementing the study are now hiring HIV-positive men to work alongside the mothers. Meet the male motivators, the next step to improving retention.